I'm Fei Sim. I'm a pharmacist. I'm the current national president of the Pharmaceutical Society of Australia. And the Pharmaceutical Society of Australia is the peak body representing all 36,000 registered pharmacists in Australia, regardless of specialty areas. I'm also an academic and a senior lecturer at the Curtin University in Western Australia. PSA 23 is the national flagship conference for pharmacy by the PSA, and who we are as PSA, we represent all pharmacists registered in Australia. So in Australia, we have 36,000 registered pharmacists with various specialty area and working in various practice settings. And what we believe in is strong support for pharmacists in terms of training and education, and with strong guidelines and practice support. And at PSA 23, that's exactly what we're trying to showcase, which is high quality education conference for pharmacists to get together, to learn, to connect, and to better prepare them for their work. This morning, we're very grateful that we have our federal government's Minister for Health and Aged Care, the Honourable Mark Butler, and also the Assistant Minister for Rural and Regional Health, also the Assistant Minister for Mental Health and Suicide Prevention, Emma McBride, here addressing the delegates. The government has been very clear in terms of their agenda and commitment to strengthen primary care. And we know in Australia that there is a strong need for us to strengthen primary care and our overall healthcare system for various good reasons. Reason number one, we know that we have an aging population in Australia. And what comes with an aging population? Increase in healthcare needs and healthcare expectations. Also, we know secondly, in Australia, we know the use of medicines is on the rise. And we also know that medicine should be used judiciously. It should be used with high quality, with safety, and with effectiveness. And we know that wherever medicines are used, there's always going to be a chance for medication misadventure. And pharmacists are medicine experts who can help to significantly improve medicine safety. Now, the third thing as well is we do know that in Australia, access to primary healthcare services, including to some of our very highly trained GPs, can be challenging, especially in some parts of Australia, more specifically in some rural and regional areas. So there is a strong need for all healthcare professionals to work collaboratively to strengthen our primary care. So the question here is, what is the future role of pharmacists, and why is pharmacists needed, and what can pharmacists do to strengthen primary care? 100%, because for a strong healthcare system to exist, we need all healthcare professionals to practice to their top of scope, and that is what our Minister for Health and Aged Care, Minister Mark Butler, has mentioned multiple times. And therefore, there is absolutely a need for all health professionals to look inwards and look at ourselves and think, how can we enable ourselves to practice to our top of scope to best deliver care to all Australians? So there is definitely a strong need for pharmacists to play an even stronger role in primary care and better integration into the existing primary healthcare system, and better connection and better interdisciplinary collaboration with other healthcare providers, be it doctors, specialists, pathologists, and other allied health professionals. Prior to the pandemic, pharmacists have already increasingly been providing professional pharmacy services in primary care, including, say, for example, diabetes management or sleep apnea, minor ailments management, and so on. However, at that time, I would probably say that it was at an extent where it was provided on an ad hoc basis without necessarily a national approach. However, during the pandemic, what have we seen? We saw that during the pandemic, there was such a strong need for people in the community to gain access to primary care close to where they live. And what pharmacists have done during that time, during the pandemic, was pharmacists kept their doors open and continued to provide that essential care to the local communities. And what we did see during the pandemic was an accelerated and expanded role for pharmacists in the immunisation space. So that was probably one of the largest things that came out of the pandemic in terms of a shift, not just in the health system administration, but also in consumer health-seeking behaviour. during the pandemic, when there was a massive, I would say an international push for us to achieve a particular target of COVID-19 vaccination rates for public health reasons, for safety, for good reasons. And that was the point in time when we needed people to have access to this very basic healthcare need, this basic healthcare service, which is immunization. And that was when pharmacists stepped up and delivered safe and effective immunization. But actually, the change is actually beyond that. So what do I mean by that? Because of vaccination and pharmacists delivering COVID-19 vaccines, a few things have happened. The first is we have seen a greater connection, and even greater than before connection, of community pharmacists with the local community. They've built that rapport, and that there is a huge consumer acceptance and feasibility for professional services in a pharmacy environment. With pharmacists involved, primary healthcare services become very acceptable. We normalise access to care, and we improve access to care. And the other thing that we've also noticed as well is that pharmacists have really been very responsive in terms of stepping up to meet any requirements necessary, whether it's to meet legislation or regulation requirements, or to meet some of the protocols or practice guides, for example, building infrastructure within their pharmacy so that you have a private consultation area or screening area to provide professional services, whether it's to build internal workforce capacity with staffing, with the layout, with the workflow, to enable pharmacists to deliver professional services. So that really has set future capacity to deliver more in the primary care environment by pharmacists. So those things, I would say, has the shift in the role and the scope of pharmacist practice has largely driven by not just the aspiration of pharmacist or pharmacy as a profession, but is largely driven by healthcare needs and the expectations of consumers and patients, and just basically what the healthcare system is expecting us and it's needing. And coming back to the point around scope of practice review, well, now the imminent scope of practice review is obviously not going to just based on the information available, it's not just going to focus on pharmacy. It's going to take a wider holistic lens across the healthcare system, and that's going to involve all healthcare professionals as well. And of course, pharmacy will be a part of that. And I think this is only just the start. And based on the information that we have and what Minister Butler shared this morning is his commitment to commence the imminent scope of practice review. Also today we had departmental representation here to walk us through around some of the implementation, but we're still at a very early stage, and we'll be very happy to have more conversation in due course when we have more information about that. Our vision is for all Australians to have the best care possible through excellence in pharmacist practice, because we believe that pharmacists have a lot to contribute towards a sustainable health system, but also contribute towards better care for all patients, regardless of where they live. And one thing I do want to point out is we advocate for equitable and improved access to care by all Australians. But we also at the same time want to ensure that that is done safely and effectively. And at the same time, medicine safety is a key agenda at the PSA, because we strongly believe that there is a greater need for us in Australia to improve medicine safety in this country. Yes, we have one of the best healthcare systems in the world, but we also do know that we have some challenges within the country, and these can actually be addressed. So I mentioned earlier around medicine use is on the rise. So we know in Australia medicine use is on the rise. We also know that wherever medicines are used, there's a chance for medication-related problems, or what we call medication misadventure. We've also got strong studies and strong evidence to demonstrate that when there is a pharmacist intervention involved, through medication management reviews and providing recommendations on how we can make changes to the therapies and the medication of the patient, we can help improve medicine safety to the point where we can help reduce hospitalization by 50%. So to give some data as well, that every year our Australian healthcare system, so there's 250,000 hospitalizations every year caused by medication-related problems. And this is just the reported ones, right? These are just based on the reported numbers. At least 250,000 a year of hospitalizations were caused by medication-related problems. And half of that is preventable, have been proven by evidence to be preventable. And I would always go back to preventative care, because if we have a healthcare system that is already stretching, and we know what's about to come, we know that we've got an aging population, and we know what comes with an aging population, and we feel strongly that the aging population absolutely needs to be protected and to be looked after. We are in Australia, healthcare is not a luxury. Healthcare is a basic need, and we need to make sure that people can continue to gain access to care. So the only way we can do this is also, in addition to allowing our professionals to practice at top of scope to improve health system efficiency, we also at the same time need to look at how can we focus on preventative care, so provide care to people before they get sick. What can we do? Things like immunization. What can we do in primary care? Manage minor ailments more efficiently, more effectively, in a timely manner, so we prevent the condition from getting worse. We prevent unnecessary emergency hospital department presentation, and we prevent hospitalization. What can we do in medicine safety? Have pharmacists involved, working collaboratively with the patient's doctors, I will need to emphasize, and make recommendations to optimize patients' medications and prevent medication misadventure, and therefore prevent hospitalization. All of those things will go a long way to ensure that we can have a more sustainable health system. And therefore, the people who really require that level of healthcare care will be able to get the care that they need at the time that they need it. So I'm really proud to say that today, this morning, in the presence of Minister Mark Butler and Minister Emma McBride, we launched the new version of the Professional Practice Standards. And I do want to take this opportunity to acknowledge everyone who's contributed to this, because we have some amazing PSA team who have worked tirelessly behind the scene to get this up. But also importantly, we've got leaders and representation from all other pharmacy organizations who have contributed to this as well in a very collaborative manner. So I do want to emphasize their contribution to this work. And why is this important? Absolutely foundationally, if that's even a word, fundamentally important. And it's crucial. Why is that the case? As I mentioned earlier, yes, we want to make sure that we can work towards a sustainable health system by allowing people to practice at top of scope. Yes, we want to improve access to care, but all of this should be underpinned by a strong, robust framework to maintain quality and standard and safety of the work that we do. So what the professional practice standards do is it outlines the minimum sets of expectations for pharmacists to adhere to in all of the clinical activities that a pharmacist would undertake. And this is the very first time that the professional practice standards have actually mapped this based on the medicine's management cycle. I mentioned earlier that pharmacists are medicine experts, and we have evidence that when pharmacists are involved, we can go a long way. But we want to make sure that that work is underpinned by a solid foundation and to provide some clear guidance for pharmacists to undertake this work. So they've been in the last iteration was in 2017, and in the last 6 years, there have been a significant paradigm shift in the way we practice pharmacy. There have been new services, there have been new areas of practice as well. So it was only timely for us to look at our professional practice standards that underpins the very foundation of our practice and make sure that the foundation is strong, but importantly, it's contemporary, it's modern, it's fit for purpose. And that was the whole reason why we really focused on developing the new professional practice standards. And this goes a long way to not just guiding existing registered practicing pharmacists in their own practice, because what we're expecting is pharmacists will then look at this. And we have also developed an online tool for pharmacists to self-assess this, and they can then apply this in their own practice to improve their own practice. That's for the already currently registered practicing pharmacist. But also, this goes a long way to influence the way we teach future pharmacists. So I'm talking about our students, our interns. So universities will create materials, will create curriculum. They will need to have their curriculums accredited. And a lot of these materials, when you teach, this is probably coming from, my passion as an academic, as an educator. When we teach, students and health professionals, we want to make sure that we teach them for the things that they actually need to know. Not teaching them just for the sake of teaching, but you're actually teaching them something that's relevant. And in every single module, personally, when I teach, I would make sure that everything that I teach is mapped against either the competency standards and or the professional practice standards, because we want to make sure that we're following current guidelines and we're delivering students and graduates that can actually deliver on the work that we want them to. So this will go a long way to also help ensure not just current practicing pharmacists, but also the utilization of these in curriculum development and in the way we teach the future generation of pharmacists.